Hi, everyone, and welcome to JASE Therapy's exclusive podcast series on self-care for things that you can do for yourself in between your trip to your massage or craniosacral therapist's office. We are proud to offer this, and this is our very first podcast. Remember, if you are in the Chicagoland area, we would love to see you as a patient. You can schedule online at www.jasetherapy.com. The first topic I wanted to talk about today was TMJ dysfunction. TMJ is pretty common. Well, actually, everyone has TMJ. TMJ is the temporomandibular joint. And a great many of people have dysfunction of that joint as well. In my professional opinion, TMJ is usually a symptom of an underlying condition. As opposed to just a dysfunction itself. Now, there are cases where it actually is a dysfunction, such as misalignment of the jaw, or if there's been trauma to the area, the facial bones, that sort of thing. But what I wanted to touch base on today with TMJ was how much it plays in the stress and anxiety of our day-to-day lives. Whenever we are stressed or anxious about something, our body goes into its primitive fight or flight response. This fight or flight response causes our jaws to clench. Our bodies naturally have the ability to deal with and to process these short bursts of anxiety or these short bursts of stressful situations. We actually need it for our survival. But what our body is not built to do, and it is not able to do, is to carry that stress or that anxiety for long periods of time. If you're constantly in fight or flight due to anxiety or stress, and you're clenching down on your jaw, this will cause TMJ dysfunction. It will cause a grinding of the teeth, clicking of the jaw, and it will cause jaw pain. The best way to alleviate these kind of symptoms when they're associated with stress or anxiety is to make an appointment with your massage and or craniosacral therapist so that we can determine the underlying cause. If we find out why you're in fight or flight, if we find out why you're anxious, or if we find out why you are stressed out, alleviating the cause will then alleviate the symptoms of TMJ. But I wanted to go over some self-care techniques for TMJ dysfunction, or just maintenance basically for TMJ that you can do on yourself in between visits to your massage therapist or your craniosacral therapist's office. Pretty easy, pretty simple to do, and I would recommend you doing it a couple of times a day. It doesn't take very long. Let's get started. In order to properly treat yourself with self-care, you have to have a little bit of an understanding of the structures that we're dealing with, the muscles that are really tight, and the bones of the skull that are affected by the tightness of this TMJ. So I'm just going to take you very briefly through a couple of illustrations and graphics so that you can kind of visualize what's going on when you're suffering from TMJ dysfunction. Let's take a look at the muscles and how they're affected. There's the joint there. There is the masseter, and there's the temporalis muscle. All of these get very tight with TMJ dysfunction. Here's a skeletal view. The joint again. There's the temporal bone, followed by the parietal bone. There's the sphenoid bone. There's the mandible. Then there's the angle of the mandible. You see the angle comes out at about a 90-degree lift there. Keep that in mind. We want to remember to go 90 degrees out in this self-care technique I'm about to teach you. So this is our demonstration here of TMJ self-care. As you can see, I'm finding the TMJ joint right here. You're going to want to feel for that tightness, feel for that ridge that we just saw in the diagram there. First thing we're going to do is compress, and we want to remember to compress up. So as you can see, my fingers are in the joint compressing up towards my head. Once they go all the way up there, I want to readjust. I want to find that groove again. I want to find that tightness in the muscles and tissue around the joint. And I'm gently going to compress down now. Just really starting to alleviate that tension. You can even see in my eyes there as I start to zone out. It's a very nice, relaxing feeling. You're just going to want to follow that tissue very gently all the way down. And as you can see, you can barely see my fingers move. These movements are very, very subtle. The tissues that we're dealing with are very small in the structures themselves. So we're going to follow that all the way down to the mandible. Remember, we talked about the mandible in the earlier section. And when we get to the mandible, you're going to feel kind of like that right angle right about there. And you're just going to want to do a 90-degree tilt right off. I'm going to show you now from the side angle pretty quickly here, but you're going to want to go a little bit slower. As you go all the way down, get to the angle of the mandible there, and just let it go. Pretty easy. So thank you very much for tuning in, and I hope that you have found the TMJ self-care informative, and I hope it will help to ease any TMJ dysfunction or discomfort that you have. Remember, if you're in the Chicagoland area, JASE Therapy would love to see you as a massage patient or craniosacral patient. You can schedule online at www.jasetherapy.com or give us a call at area code 773-510-8930. Namaste.